Hi, welcome to the show. I'm a huge believer that healthcare is a marketplace, and we as patients should be able to choose our providers based on which ones best meet our needs. Today, we're talking with Rachel Drayer and Doug Stroop, both physician's assistants and founders of Vitality Wenatchee, a new healthcare option here in our valley. Thank you for being here, Rachel.
Yeah,
I'm
thank you.
excited to talk with both you and Doug about not only your vision for the new practice, but also just what brought you to this point and what you were seeing in patients that maybe you can be a part of their recovery or be part of their health before to be proactive instead of reactive. And I know that's part of your goal. So thank you for being here.
Thanks for having us.
Let's talk a bit then about what you see. We're going to talk about women's health more specifically. We'll talk about men's health with Doug, and then we'll bring you both together at the end of the show. But what are some of the things that you see over and over again that if women just had more information for different areas of their health, hormone health, different things like that, what is something that you see over and over again that if they just had more information, they could prevent some of the diseases they come to have treated when really it could be a prevention approach?
I think for starters, I see a lot of women who just don't know even specifics about a menstrual cycle. They don't know the phases of a menstrual cycle, what's normal and what's not. I think a lot of women they have very painful periods or they have long periods and they just don't know that some of that may be abnormal. I think I run into a lot of women who don't know very much about the way the brain and the thyroid or the ovaries works. I think just some of that knowledge, it's not something we grew up learning about. It's not something that's readily talked about. And, unfortunately, hormone replacement therapy, women's hormones, menopause, perimenopause, postmenopause, that doesn't always get talked about. I think anyone who's on social media right now has probably seen the swing that's happening.
Right.
And I feel like there is a huge paradigm shift right now and a big pendulum shift in the conversation about menopause, which works in our favor because women that are coming to see me have already done some research. They are following Instagram or TikTok accounts that talk about, estrogen and progesterone and menopause. And a lot of the conversations I have with women are about bone density and nutrition and weightlifting for exercise, and then conversations about those hormones. But I just think that historically that hasn't been a part of the conversation.
I think the parts that I'm learning most about is just the importance of weight-bearing weight, the
Yes.
importance of lifting weights and having muscle mass in our skeletal system. I think sometimes you probably see women who we often just want to fit in our jeans.
Right.
We're not necessarily thinking about how we feel and how we maneuver our bodies and how we maneuver everyday life by either carrying the extra weight or not feeding ourselves the way we need to sustain what we already have.
Right. And, the things that we know are if you're not eating enough and you're undernourished, you're not feeding your bone health. If you've been a high-level athlete who's gone for long periods of time without having a period, your estrogen levels are going to be different, which is going to impact your bone density. So if you're not eating, you're in a starvation mode, whether that's because of nutritional habits or exercise habits even, that can lead to lower bone density. And so, we are lucky enough, we decided when we started Vitality to have a DEXA scan to do body composition, because knowing not only where your body fat and your muscle mass is, but knowing where your bone density is important. Because as we get older as women and our estrogen levels drop and our progesterone levels change, our bone density gets less as well. So if we know where people are now, we can help prevent some of that. And load-bearing exercise, like you were talking about, is a huge way to do that. I heavily promote heavy weight training. Like women should be lifting heavy weights.
Well, and also one of the things too that I remember I've had a couple of those scans, and I can't look at the scale because I carry more muscle than the average person. My friend who might weigh 15 pounds less might have 5-7% higher body fat than me. So I think that idea of the scale has been a measure for a very long time, for as long as I can remember being a kid, growing up in my house. The diet and the scale went together. Right. And what if we can focus on something else, some markers that you provide through the testing that you offer and how our clothes fit, then we can start to get more informed and educated about what really tips the scale, so to speak, about our health.
Yeah, when we do the DEXA scan, it gives us down to 100th of a pound or 100th of a percent even. It tells you where your body fat is, where your lean muscle mass is, and it gives us your bone density. And, I think what you were alluding to is we all know that BMI is not a great metric
Hmm.
because it takes all of your body weight, bone, muscle, and fat, and it divides it by your height. So if you're like me or like you, I'm short and strong.
Hmm.
So I always tip towards the obese, but really I'm 5'4" and 130 pounds, like probably not obese. But when we look at the DEXA, what it does is it actually parses that information out. So it gives us just your body fat numbers over your height and just your muscle over your height. And that's a far better metric for how your personal body is doing than a BMI.
What do you notice in your patients when they start to get this information, especially as it applies to hormones? So I'm someone who had cancer when I was 24, and I stopped taking birth control the night I found out I had cancer. I just didn't want any hormones, didn't want anything going on, and I never took it again. And I won't get into all of my personal health stuff, but I've been very careful about what that hormone therapy or what those replacements might look like for me someday. And I think that having someone who's really attuned to your own personal story, there is definitely not one fit for all. We have to take in consideration my comfortability with some choices, not just the results of those choices. Because if I'm uncomfortable taking something, my compliance is going to be much lower. And if I'm not part of the decision making, my compliance is going to be much lower.
Yeah. So something I like to do for clients is first we sit and we talk. When I tell people consultations with me are a little bit more like a therapy appointment and a little less like a medical
Yeah.
appointment, it's true. Because I want to know all of those things. I want to know what did growing up look like for you? What have your nutrition and your fitness habits been like? What's family history? Is there a cancer family history? Is there a thyroid family history? And Doug and I both do a good job of getting a really thorough, impression as to who this person is in front of us. And then we talk about options. We do blood work here. So I want to check to see, do we even need to have you on anything? And if you do want to be on something and your lab values match and your symptoms match, it's kind of a whole, a nice
The big
interplay of all
picture.
those things. Yeah. Then we sit and have a conversation. And, when it comes to women's hormones, there are non-hormone options, so supplement options. There are bioidentical options. There are hormone options. There are gels and creams and sprays and patches and rings. There are so many methods out there that it's up to us to have the information and to pick, if you were coming to me, I would say, here's 2 or 3 options in each category. Let's talk about what is going to be best for you. Do you travel a lot? Are you somebody who doesn't really want to do X, Y, or Z, so that we're really picking the best possible option for you and the best possible option for whatever situation might be specific to you.
Making that informed decision.
Yeah, we really want our clients to be part of the process. We are
Right.
not here to delineate information. We're here to educate, which is one of our core tenets. We really think that educating everyone in the Valley, even people just who follow our social media, even if you're not a client here, it's fine. I still want you to have the information. And for us, it's about educating people on options and then working together to find an option. And then if at some point that option isn't really what we want, great. We stop that and we reassess.
Yeah. That's a good plan. I like that plan. And so let's take a break. When we come back, we'll talk with Doug. You'll be off camera, and then we'll bring you back both together. So
Sounds
we'll be
great.
back in just a moment. Thank you for being here, Doug. Rachel and I were talking more specific to women's health, and as a woman, I can contribute greatly to that conversation. Want to have a conversation with you about the men's side of health because you have specific plans in your practice to help on the men's side of things, while she'll help on the female side of things. And let's just talk about the same question I asked her. What are some of the things you see most commonly men coming to you to talk about that can be a more of a preventative approach than a reactive approach to something that's already maybe months of symptoms down the road?
Well, I think one of the biggest things guys come to me all the time about is that they hear about testosterone replacement therapy. That's a lot of what brings them in the door, is that there's a lot of information out there. There's ads, there's things like that all over the internet and TV about testosterone replacement. So, a lot of guys that are fatigued or feeling like they can't build muscle the way they used to, or can't lose weight the way they used to, or just are generally not performing athletically the way they used to, feel like they, may be candidates for TRT. So for a lot of guys, that's kind of what brings them in the door. But for a lot of them, it's whether or not they're exercising, or whether or not they're, doing some of the basic things, as Rachel mentioned. Diet and exercise are big. And a lot of those, if you're not taking care of what I call the low-hanging fruit, to begin with, then that's, not very helpful to get started with. So,
And some of I have a friend, for example, who his partner encouraged him. She encouraged him to get his PSA test, and that with no symptoms whatsoever. And we're talking about it's an abbreviation for something, PSA.
Prostate specific antigen.
Yes, we're talking about prostate. So, and he got that test, and his numbers were quite high, and he had to have a surgery and a possible treatment. That all these things with no symptoms whatsoever. There are very few tests that we can get that are that informative about a specific roadmap that could lead to cancer than to get your PSA checked, and it's a very simple blood test. Do you find that people are resistant toward getting those kinds of tests because they don't want the information, they don't want to know that something's wrong? Or at what age should the men start getting that test? How do you go about something that's really quite simple to track and look for and pay attention to as they progress in life?
Well, PSA is a tough one. PSA is one of those tests that we say is very sensitive, but it's not necessarily very specific. So it is a measure of it's called prostate specific antigen for a reason, but there's a number of different reasons that somebody's PSA can be elevated that does not necessarily point to them having cancer. And so it's actually a test that you've seen some physicians and providers move away from doing on a regular basis, just because it can instigate a whole host of tests.
Lead you down the wrong path. Mm-hmm.
Exactly. Or lead to like sexual dysfunction with biopsies and things like that. I'm not saying that happens all the time, but it's definitely one that we've kind of had to kind of temper a little bit with how often we do the PSA. At least I've seen that in regular, in internal medicine and things like that, where they're just like, we gotta be a little bit careful running this test because people may or may not have an issue. Now, I also have other acquaintances that have had prostate cancer with, again, non-elevated PSA. So it's not, it's not 100%.
So that comes into play where you really need to be working with your doctor for that whole big picture, like we were talking about with Rachel. And it's hard to get to know a patient when they come once a year, when they're just coming for some basics. And then some people don't even come once a year, so they don't come until they have a problem. From a preventative point of view, with your goals being to, prevent disease, what are some of the things that men can do to try to ensure that diet and exercise we talked about, but in terms of a relationship with a provider group like yours, what are some of the things you'll be looking for, or what types of blood work or things you'll be doing on the male side of things to really get them a big picture of their health?
That's a good question. I mean, there's always a standard blood work that we get that's going to look at kind of the usual things that you'd look at if you went to a regular provider. I do tend to focus a little bit on, testosterone. I also really like looking at A1C and TSH, which is, a thyroid hormone, or at least it's an indicator of your thyroid hormone. Because a lot of these have to do with how men are feeling. As you heard from Rachel, women's hormones are quite a bit more complex than men's. So that makes, my side of the equation a little bit easier. But I like to look at all those hormones and just kind of ask the men how they're feeling, and then test after that and see see if their blood work corresponds to how they're feeling. But as far as, sorry, I misunderstood your question. Yeah.
No, that's it. That was exactly what I meant. One of the things I was thinking about in preparing to have this conversation with both of you, I thought, what would be the equivalent to the cycle that women go through? Like Rachel was saying, education about menstrual cycle, and then as menopause starts to happen. And I thought, I don't know, there is an equivalent to that part of the conversation, because you're saying that men aren't nearly as complex in terms of those parts of our bodies that age.
One of the things that we're finding with a lot of with men's health, especially in regards to testosterone, is that they don't get tested when they're very young. So, and what I mean very young is, in our group of patients, a younger patient would be somebody that's in their late 20s, early 30s, right? Not teens. And so we don't really have a great metric for what their testosterone is at that age. And then by the time they get to late 30s, early 40s, or 50s, or 60s, They may have a level that is, clinically in the quote unquote, normal range, but it may not be normal for them. And so that's
Okay.
something
Yeah.
that
Makes
I
sense.
would like to see a lot of guys start doing, is not they necessarily need medication, because I am not a fan of having people take
Mhm.
medication if they don't need it. But if they got tested periodically, once every year, once every other year kind of thing, for some of these basic panel of tests, then we have the metrics. So down the road when they are feeling, less energetic, or, what are the number of symptoms they can be experiencing with low testosterone, that we kind of know, hey, this is where you were at when you felt really good, and this is where you're at now, and it gives us a much better target to hit as far as any kind of replacement therapy goes.
I compare that to perhaps my dermatologist says that people should be getting skin checks much earlier than they do. They wait till they're starting to get freckled or moles and have those things checked. And so I encourage my son, who's about to turn 25, go for your first skin check, get mapped out. Let's see what looks normal on you so that you can see if anything comes up over the years. And he did that. And that made me feel like, okay, that's proactive. And then when you're talking about getting testosterone checked, I would think that would be something that someone his age should also probably do so that
For
you
sure.
can see the differences.
Exactly. Just gives you a baseline. And that's something that I see, I have a lot of my patients come in now. We just don't have that baseline. We don't know what they were. And so it's, we have a pretty good idea what normal looks like. And for most of my patients, I have initial test, blood work and interview and everything like that. And then 6 weeks down the road, if they've started therapy after 6 weeks, I have them come back and we do repeat testing. But the big part of it is, how are you feeling? Because that's one
Yes.
of the most important metrics. Are you feeling better? Are you, are you noticing improvements in or at least improvements in the deficits you felt like you were having before? So,
And I think I like the idea about a clinic like yours or practice like yours is that if people start coming to you when they're feeling well early on, because we think of a doctor visit when you're not feeling well or just one annual wellness visit. But if they came to you to get those baselines and start building that relationship, I'm a huge believer in building a team of trusted providers. And you both still work at Confluence, so you're going to have your Confluence providers if you live here, a provider like yourselves in a different practice. But even your dental practice, everything works together. So the more that they're communicating, people are communicating with you from the very start, the less you're kind of chasing and reacting to the things that might happen later on.
for
That's
sure.
the goal, right?
Oh, exactly. I mean, you hit the nail on the head, and I fall into that bucket as well. I never go to the doctor. I never went to the doctor before, and I'm still bad at it. But for most guys, I shouldn't say for most guys, for most people in general, if you're feeling fine or feeling well, you don't tend to go to the doctor because it's a pain in the butt, right? You're down there,
Yeah.
you wait. If you can give an appointment, especially with kind of the way healthcare is in general all over the place now, it's very difficult to get in to see a regular provider. So, and that's one of the things that Rachel and I really talked about when we started this clinic is, what is a number or a level of patients that we can see comfortably and still make people feel like they have access to us all the time? Because as Rachel mentioned before, having access and feeling like you can ask questions and the whole education aspect of it is really huge. And patients feeling like they're making informed decisions and they're actually having a conversation about their health instead of being told what to do about their health I think it's a much better way to get people to be on board with whatever we're trying to do. So,
Absolutely. Let's take a break and we'll bring Rachel back and we'll talk with both of you for just a couple of minutes about just your plan for your practice specifically, what your goals are, and we'll talk a little bit further with that. We'll be back
okay.
in just a moment. We are back talking and it's Vitality Wenatchee, the Rachel and Doug, your new practice here in the Valley, a new option for patients throughout the Valley. I'm all about options in healthcare. It is a marketplace. Think if patients understand that, we wouldn't keep going to the same provider or same beautician who was giving us a poor haircut. Do they use the word beautician anymore? I don't know. But let's talk then about your vision, because one of the things, I work with a lot of patients and caregivers as an educator who feel rushed in an appointment, who say, I don't get my questions answered. And I say, well, let me see your questions. And I see there's 20 questions for 20 minutes. So part of what I try to do is shift the responsibility onto the patient and say, okay, what's your role in this? Can you go better prepared? Can you eliminate some of those questions or figure out that 5 of those questions are really the same question and get real succinct in your vocabulary and your knowledge of your body and its importance? So one of the things I know that's a priority for you both is to take on whatever number of patients that ends up looking like, and so that you can give them that individual time and not shrink the appointments, but later add another provider so that we as patients don't feel rushed. and you can get to know them and even help them to understand what they need to bring to the table during those brief appointments.
Well, I will say, so for starters, our initial consultation visits are booked out for at least an hour, sometimes even longer. And what that looks like is you're not coming in for a 20-minute appointment. You know, our consultations are booked for an hour because we want people to sit and talk. And I tell people, you know, one of the first questions I ask my clients is, when is the last time you felt good? Sometimes I just need to prompt people a little bit and then they start talking. And I think as medical providers, Doug and I will both tell you the most important thing you can do is just let a patient talk.
Right.
And the more you let somebody talk and give them an open space to talk, they'll not only tell you what's wrong with them, but they'll tell you where they're at and how they want to get there. And so for us, it's a collaborative approach. But we just think that having the time to sit and talk to people is something that we can do and we want to keep doing.
Well, we just have 2 minutes left, or 1.5. So Doug, just quickly, can you tell me too what your priority is in building that trust? What approach you take to make sure that we are building a team of trusted providers and that you are one of those providers for people?
Well, like Rachel said, one of the most important things for us is just having the time to sit down and talk to people. And we worked really hard at our clinic here to create kind of a safe, open space. A safe's kind of odd word. It's just a comfortable space.
Sure.
Here, spend time with us and not feel like they're rushed, because that's one of the biggest things I noticed from working in, at a regular clinic, the hospital, is I just don't have enough time. I don't have enough time to sit down. I'm always feeling pressure to kind of move on to the next patient. And one of the things that Rachel and I really wanted to do was create a space where that's not the case here. People can come in, we can sit down, we can talk, we can find out what their concerns are. And then you mentioned earlier, they might have a list of 20 questions. And if we have time to have that conversation, we can kind of narrow that down to, distill it down to a handful of really pertinent questions for them. So I think giving them the space to talk is the most important.
At this juncture, you don't take health insurance, but people can visit your website and learn how your practice works and how the payment plans work and what you can get done there and what might be referred out to Confluence. And knowing again that that's building a team of trusted providers. If you trust the providers you're working with, you're more likely to comply with the decisions that you help make. And I think that that's a really good place to start. It's good to have all of these options for patients who might never face disease, ideally, but they will most likely face it with somebody in their lives. And understanding how to navigate healthcare is such an important tool that a lot of people learn the hard way in a learn as you go, quick-paced diagnosis, where here's some practicing tools that they can utilize with you all while they're well or while they're trying to reverse something that's reversible.
And it's nice when we have those established relationships with people, because if they do need to see somebody at the hospital for something we don't provide here, we can certainly help, like you were talking about, hone down those questions and what to ask and how to be part of that relationship.
Thank you both for being here. I wish you the best.
Thank you.